Surgical Safety, Creating a Safety Checklist by Campbell, RN, BSN, CPAN. The objectives of this course are to identify healthcare-associated risks, to explain universal protocol for preventing wrong site, wrong procedure, and wrong person surgery, as defined in the Joint Commission's National Patient Safety Goals, and to verbalize understanding of a standardized approach to the use of a surgical safety checklist. It is important for nurse leaders to monitor quality metrics for their department. Quality issue identification can present to us in many ways. This quality improvement project is due to a significant specimen error that occurred in the operating room, where a specimen was discarded instead of sent to pathology as ordered. Through an intense review of this error, discrepancies were noted in the end-of-case verification process. This process is often called the debriefing. This led to auditing by the nurse leader for the end-of-case verification process through direct observation. Not only did these observations show a lack of standardized debriefing, but it uncovered a lack of a standardized timeout process as well. The timeout process was followed, but it was inconsistent from nurse to nurse and physician to physician. The problem with the current state is lack of standardization. This lack of standardization can increase the potential for miscommunication and medical error. In fact, the Joint Commission found that 2/3 of sentinel events reported in healthcare are related to miscommunication and inadequate teamwork. The cost of medical errors is great. Unsafe clinical practice causing medical errors can cost as much as $25 to $50 billion a year. 234 million surgeries are performed worldwide each year. Shocking statistics show that between 3 and 16% of those patients suffer from major complications. These complications can often be prevented with improved communication and teamwork. Nurses and healthcare professionals are aware of risk for medical error and the importance of quality improvement initiatives. So why do we continue to have medical error? Research shows us that medical errors are due to interruptions. These interruptions can cause poor communication or misunderstanding. Also, poor staffing models or staffing levels can cause medical error because of lack of teamwork. A fear of reporting errors or near misses continues to exist in healthcare today. Nurses often ask, why do I need to report a near miss if it did not lead to an error? It is important to stress that near misses can be used to identify trends and process improvement projects. It is extremely important that nurses feel empowered to report these near misses. Reducing surgical errors does require change and an innovative way of thinking. Nurses cannot be afraid to implement evidence-based practice. We must stress that we can no longer do things the way we have always done it just because it is comfortable. We must begin to think outside the box and implement evidence-based practice to impact our patient outcomes. Research shows that having the patient involved in a timeout process before the induction of anesthesia creates a more positive experience for the patient. Standardization of this process is also important, as it creates consistency among all healthcare providers, improving communication. The World Health Organization developed a surgical safety checklist. This checklist involves the completion of certain steps. These steps occur first before the administration of anesthesia. This is often called the briefing. Then again before the incision is made. This is also referred to as the timeout. And then finally at the end of surgery, before the patient leaves the operating room. This may be called the end of case verification or the debriefing. This is an example of a surgical safety checklist developed by the World Health Organization. In each of these steps, there are elements that must be completed. Once the organization determines which elements will be included in their surgical safety checklist, it is important that this is carried out with every patient for every surgery, every time. To create a more robust and standardized safe surgery checklist, we will be implementing this through shared governance. The Operating Room Unit Council will research evidence-based practice related to the use of the World Health Organization Safe Surgery Checklist. The elements of the checklist will then be standardized for each step: the briefing, the timeout, and the debriefing. Clinical staff will participate in the development of a video where the use of the checklist is demonstrated. It is important to include clinical staff in the development and implementation of this process so that they feel empowered to use this consistently. The education will include review of the video and will be given to all surgical staff and physicians. Nursing leadership in surgical services will be guiding this process. It is the role of the nurse leader to improve quality of nursing practice and the delivery of patient care. It is the role of the nurse leader to observe professional standards and regulations, such as the Universal Protocol by the Joint Commission and the Surgical Safety Checklist by the World Health Organization. Through quality improvement projects such as this, the leadership of that nursing leader, promoting teamwork and following regulation, will drive such quality initiatives. Once this checklist is implemented, how do we sustain it? Consistency is the key to sustaining any quality improvement initiative. It is important to involve the key stakeholders from the beginning, such as physicians and clinical nursing staff. Monitoring and auditing through direct observation by surgical services nursing leadership is important. This information should then be reported back to the staff so that they are aware of how well they are meeting this goal. Consistently following this plan will help to change the culture within the department. To change the culture, the nurse leader will evaluate, document, and continue to share the progress toward achieving this goal. I'm going to leave you today with this quote by John Quincy Adams. If your actions inspire others to dream more, learn more, do more, and become more, you are a leader. It is this action, this dream, continual learning, and leadership that allows us to achieve positive patient outcomes and high quality care.